back. It's still TV3 New Day. Now, we're going to be having a discussion about COVID-19 and people who have been bold enough to come out and tell their story. You remember that multimedia reported that a number of them, about 5 or so, had tested positive for COVID-19. And they were willing to share their story. Gary L. Smith, one of their sports journalists at Multimedia, was bold enough to go online and tell people about his experience. And today he's willing to share that with us as well. And so he joins us via phone. Hello, good morning, Gary.
Hello, Bella. Good morning.
Good to have you on the show. Finally, how are you doing?
Doing well, thank you. Bye, please.
All right. Now, first of all, I must say, and I even tweeted this at you, that it was very bold of you to come out and tell your story at a point when we're talking about stigmatization and the fact that people still don't have a fair knowledge about the disease and what it actually means. And so kudos to you for that. But let's start from the top. And so at what points did you realize that you had to go and test for COVID-19?
When I had a loss of smell and taste, that was the trigger that
really
set me up. Yes.
Okay, so you experienced some symptoms.
There's what do you call it? There's not an agreement as to even what an asymptomatic patient may be. Because yes.
Okay.
A lot of asymptomatic patients, even at the COVID center, will tell you that at least they have minor headaches.
At least they have what?
Can you hear me?
Yes, I can hear you. If you can just project a bit. You said something earlier. I'm
saying some patients will even tell you that they are asymptomatic. However, they record minor things like headaches.
Okay.
You get my point.
I get you.
So I had a loss of smell and taste, and that's like 2 Tuesdays ago. And that was my trigger because, that morning, as I've said elsewhere, I was going to have a bath and I realized I couldn't smell the soap.
Oh.
And then, yes. And I'm talking about, not ordinary soap. Alatrafamna. So if you can't smell Alatrafamna,
exactly.
then it's a problem. And then, because I've had some education about it, I didn't panic, but afterwards I went to eat. I remember it was something quite peppery, but I still could not taste it. So that was I called our office HR because at the time we had recorded one suspected case.
Okay.
And people were doing contact tracing and voluntary testing. So I called our HR and then we made the arrangements for me to go and do the test at the Mamobi General Hospital, but it used to be the Mamobi Polyclinic.
Okay.
Yeah. My results came in 3 days. So, 3 days, and then that was it.
Did it shock you when you got the results and it said positive?
No.
Not at all. You weren't worried?
No, worried, yes. Shocked, no.
Okay. Why were you worried? What was going through your mind?
Oh, worried? This is the most famous disease in the world.
Yeah, exactly.
So that's the first thing. Secondly, I have a child who is not even a year old. So, obviously, when you become a father, nothing is about you anymore. Right?
Exactly.
Yeah, so, that was the number one worry. Have I been infecting this child?
Yeah.
And then my wife as well, obviously.
Exactly. Now, you mentioned that at the time when you experienced the symptoms, someone had already tested positive at your workplace and there was contact tracing. So clearly you were not one of the people that were being contact traced, were you?
No, I was not.
So you did not come into contact with this person at all?
I wouldn't go because the interesting thing is that obviously you wouldn't know who it was.
Yeah.
Who had? Yes. So, but all I can say is that I had not been called to come and contact trace by the authorities or anything like that.
Okay.
I hear was voluntary testing.
Yeah. I hear that the process in taking a sample is very uncomfortable. Can you run us through what you had to go through to get tested?
Well, Bella, I have gone through 2 weeks of going through the testing. So yesterday, I had that is my first test to determine if I am negative, right?
Okay.
That is after I had tested positive. So let me start from yesterday's on.
Okay.
Yesterday at the UGMC, I simply had to spit into a small vial That was it. It's as simple as that. I mean, you just have to, like, and then.
Okay, what about the first one? Did they do the swab where they put the cotton in your...
The swab one, when I went to the Mammoth General Hospital, they literally said, open your mouth, and then they put the swab into your throat. So if you are used, and this is what I tell people, if you are used to brushing your teeth and, like putting the brush at the back of your tongue to, scrape like we are recommended to do by the dentist, it won't be uncomfortable for you at all because it literally lasts 1 second.
Okay.
They just put it at the back of your throat and then they just swab once. So I remember, even in my case, the guy, when he finished, I was going to sit down and he said, "Why are you sitting down?" And I said, "Are you finished?" And he said, "Yes, I'm done." So they take the swab, they put it at the back of your throat, they sort of wipe it like in a flash, and then they put it in a vial, and then they bag it and take it away.
Okay, so you have been in isolation for 2 weeks now. I recall seeing a few of your tweets, complaining a bit about treatment process and all of that. How has it been for you?
I was not complaining about the treatment process. I would have said throughout the period is that this is my first time being admitted in hospital, like consciously in my life. So I don't have any bad to compare with.
Okay.
Right?
But what has it been like for you? I mean, for the 2 weeks?
Well, it's been good. If you check all my posts, what I've said is that for the patients we are receiving, the food is... I always hear people say hospital food is not good, but
it's good, eh?
Yeah, it's good.
Oh, that's nice.
It's good. It's really decent. The UGMC. I'm careful to say it's the same treatment everywhere because I've not been everywhere. But at the UGMC, the place is clean. The staff are, they come in, sometimes it's like they're even mothering you, you know what I mean? Because every few hours somebody's going to pop in and say, you people, are you okay? Do you need anything? That sort of thing.
Yeah.
So what I had been, if you like, complaining, as you put it, has been, as a journalist, you always have your nose out there. So the frontline workers at the ICU, at the UGMC, those who take care of the intensive care unit patients, they do not get food or water the whole day.
Wow.
Yes, that is what I had been campaigning for. So, but as for the treatment for the patients, if anybody came here and said that they were not, I would be quite surprised.
Okay. Well, we hope that aspect is sorted. But yesterday, like you said, you went for your first test to confirm if you were negative. And your tweet said that the doctor indicated your lungs and your chest were clear.
Yes, so that is a CT scan. So one of the, as part of the thing that I've been having is a malignant cough. Now, the interesting thing about it is that you will find a lot of people who may be sort of coughing, but it's not a painful kind. You know what I mean? So it's just like a dry, irritating cough, and that's what I've had it for about 5 weeks now.
Okay.
Yeah, and for those who know about coughs are not supposed to last that long. So
exactly.
The idea from the doctors was to investigate what it is because I was getting better. Right. Now the thing about COVID is that the critical point, as I've been told by doctors, is the first 7 days. Once you go, once you go beyond the first 7 days, either two things can happen. You will get worse or you get better.
Yeah.
So in my case, I was progressively getting better, but the cough still persisted, and it's still persisting as we speak.
Wow.
So on Friday, I went for my CT scan, and then the result came, and that is what I put up. So we are still investigating what the cough is, but because of the new directives that have come from the WHO and all that, I fall into the bracket of those who
could be discharged.
Yes.
Okay. That means that you may not necessarily wait for a second test.
Oh no, it's very unlikely. Very unlikely.
Quickly before I wrap up with you, I just want to find out, since you came out and told your story, what has the response been like?
Largely overwhelming. However, disappointingly, there's still a lot of unsavory comments. Let me just put it that way. A lot of yes, please. There's a lot of unsavory comments. And
like what exactly? What have they said?
Oh, there are people who, for example, have said that I am not sick because because of the kind of coverage that has been given to COVID, or the kind of perception, people have the impression that once you have COVID, you should be bedridden and unable to do anything. But at the UGMC, there are many, many different grades of sick people. There are those who are extremely ill. So, like the guy who was opposite my room was on oxygen thing throughout the time.
Wow.
My time there, throughout my time there. So there's that level of seriousness. And then there are those who, came in with, they are probably coughing seriously or they're having persistent headaches. So they are being checked upon. So what I like to say is that the COVID experience is like malaria, okay? I mean, as you sit there, you may have malaria, but you may be doing the job because, it's not that deep, okay? And somebody may have malaria and be bedridden and can't do absolutely anything. So there's that spectrum. I was one of the luckier people because of a few factors. If I have time, I'll just talk about it in 15 seconds, if you don't mind.
Okay. Just 15 seconds so I can wrap up.
Okay. My doctors told me that, during the lockdown, as you know, we were people who were going to work all the time. So my family and I took extra precaution. I was taking a lot of, it was during the lockdown period, vitamin C, zinc. I changed my diet, so we're eating a lot of greens. We cooked a lot of food and put in the freezer. So the doctors tell me that it probably, at that time, I was building my immune system, to a point where when I got COVID, I wasn't as attacked as some of the other people. Exactly. Because all the people have come and, they have very sedentary lifestyles. They drink, they smoke, so their systems are not as probably strong as mine and so on and so forth. But there's a lot of public education to be done because I'm going to tell a story of a woman who was going to be discharged, and when she called home, she was told that, your mother has already started planning your funeral.
Wow.
Yes. So I'm going to tell that story, and it will air on Joy News pretty soon.
All right. Anyway, thank you so much, Gary, for speaking to us, and we wish you the very best. Hopefully you can, be discharged so you can come back to work as soon as possible. But thank you so much.
Welcome, Bella, and have a nice day.
You too. So Dr. Mankra is joining us from the Lekma Isolation Center. He's the lead doctor there, and good to have you back in the studios today as well. So that's Gary Elsmith telling his story. Yes. And even to start off with a woman whose family is already planning a funeral for her. That goes a long way to tell that people are still not knowledgeable about this.
Exactly.
This is sad.
It's quite sad because people still don't understand the whole thing. People still have the notion that once you're confirmed positive, you're going to die.
Yeah.
And when people don't see you in that critical state, they doubt it, whether you really have it. So it's serious, but we have to do more education, talk more about it for people to know that it's out there. But then you can beat it. You can beat it. A lot of people are beating it.
That's the thing. But if your family's already given up on you, how does that impact upon your health? Because I'm hoping my family would support me, and they're expecting me to die maybe?
So the support system is quite important in the management of this because your psychological health comes in. And psychologically, if you're not really prone or positive minded that you'd get well, it can affect you. You may get depressed and everything. So it's really important you talk to their family members. Sometimes you have to talk to them, explain things to them. It's not just only the patient, but the family members as well, so that they also understand, because their support, the social support system plays a major role in recovery, early recovery and prevention of depression.
Yeah, absolutely. And for you to even come out and tell your story again, like you said, the support was overwhelming, but there were some unsavory comments. And I'm sure even aside the fact that people were expecting him to be bedridden, I'm sure that stigmatization is subtly going to be present. How do you get over this, especially if you've come out to tell your story and now people know that you had COVID? You can't avoid having people running away from you. So, how do you manage that?
First of all, I was quite proud of him to actually come out and say all these things. And I've read some comments on social media, which, like he said, were quite unsavory. That's the best way to put it. And I think the best way is for people to still understand. We still have to talk more, explain more to people. The lack of knowledge plays a major role in this, and the fear as well. So more knowledge out there, we educate people more, we let people know exactly what is going on, how to beat it, and I'm sure, hopefully, there will be a change.
Hopefully, we're keeping our fingers crossed. But I mean, eating well, staying safe goes a long way to play a role.
Yes, exactly.
How your body reacts to the virus?
Yes. When so we've been talking about immune system right from the beginning. So if you're stressed out and everything, your immune system also goes down. So adequate rest, good diet, cutting down on some social vices like smoking and drinking would also go a long way to help boost your immunity. Then when you have it, well, you can just beat it.
Oh, okay. This is serious. I don't know how people are going to cut down on that, because I mean, if I've been very sedentary for 6 months and then all of a sudden, because I've heard about COVID-19, I decide I'm going to try and eat greens for just 1 month. Does that make any change?
So you just don't decide to do it for just 1 month. It's a conscious effort to do it from now. So that you're changing your diet, you're trying to inculcate some physical activity to your lifestyle. If you always just work, sleep, you try to fit in some walking hours so that just to exercise yourself.
Okay.
And your regular checkups would also help as well.
So work, sleep is not enough?
No, it's not.
Okay. On that note, some of us will have to really make some very vital changes in our lives. But I mean, with the patients that you may have come across as well, so far, are we, reducing the numbers of people who are getting infected, or is it rising? Because now we have more discharges and recovery. So that leaves us with less people being infected and currently under treatment, right?
So we have more people getting infected.
Still?
Yes. We have more people getting infected. So thanks to the WHO new protocol or guidelines now our recovery has gone up, and the isolation units are not choked up because people are actually okay but waiting for the double testing, so they can't be discharged and everything. So now that has opened it up so that more people can be treated and everything. But then sadly the numbers are going up.
You're a doctor. Tell me what you think about this discharge protocol. Does it necessarily mean that these people are not going to transmit the virus?
So, well, according to the science, what we've read now and backed by WHO is that usually from day 7 or up to day 11, the person doesn't transmit it.
Is it absolute?
Yes. Well, from research.
Okay.
From research. So it's backed by research. It's not just something that was done in Ghana. It was backed by research. And one thing too is there's some challenges with the PCR. Now, PCR detects the DNA that is in the person. Now, DNA can be in a dead virus. It will still pick it up. So we have people who have recovered, but then the PCR will detect these DNAs and it will still read positive.
Okay.
But the patient has actually recovered. Now, shedding of the virus can extend to maybe 4 weeks or even 2 months, depending on the area of the body you're looking at. But that doesn't necessarily mean the person is infectious. So from the research that's been going on...
Wait, sorry, no, you just confused me. You said shedding of the virus. Does that not mean you're infectious?
No.
What does it mean?
Shedding of the virus is that we may detect some of the virus. Maybe even be in feces.
Okay.
We may detect it, but that doesn't mean you're infectious.
Oh, is it?
Yes.
Okay.
So infectivity is basically 7 to 11 days. So that's why for WHO protocol, they said 10 days. But for Ghana, we are using 14 days.
Okay, let's go back to the issue of shedding of the virus again. So shedding means that it's still in your system.
Shedding means that you're passing some of the virus, okay?
Passing it how? When you're passing, does it not mean that you're infectious?
No, you could be shedding through feces. Remember we read, I don't know whether you read that some virus can be in the feces and everything. But we said that doesn't mean that it's transmitted through the fecal-oral route, okay?
No, but they told us as well that if someone is infected and they use the washroom, if you're flashing, you should be careful. You should even cover the seats because particles could jump out and that could also infect the person who may be next to you.
So we were thinking that way because we detected these viruses in the feces, okay? So now what we are learning is that they can shed, but then that doesn't mean the person is infective. That's why after that period, remember Gary made something about the 7th day and everything. Yeah. The period where your infectivity is quite high is from 7 to 11 days when the symptoms started. And then for those who tested, around the time they tested till 7 to 11 days. So they're about. So once you cross that area, the probability of you infecting other people comes very low.
I see.
So people after that period are not infectious. So that is why that's actually the backbone for this new guideline.
Okay, quick one. I have to go, but does it mean they can be reinfected?
Anyone who recovers can be reinfected. We don't have immunity after recovery, so you still have to continue your protocols, follow everything, make sure you wear your mask, and social distancing.
Are you more prone because your immune system has been compromised?
No.
Okay. Okay. All right. Anyway, that's Dr. Emmanuel Amankwa, and he's a lead at the LECMA Isolation Center, educating us a bit on coronavirus. Thank you so much.
You're welcome.
We've also been speaking to Gary Al Smith. He is a sports journalist, and he was also telling us his experience with the virus. He's currently under isolation. And so we'll continue more with the COVID-19 discussion on COVID-19 360.